here we are in 2011 in the Birmingham city centre. The UK currently has the highest drug-related death rate in Europe, has done so for many years now. We know that over half of Birmingham injecting drug users are hepatitis C positive. We are already providing them injecting equipment through needle exchanges and chemists for them, knowingly that they're going to inject illegal drugs. Unfortunately, there is no safe place for them to do so, for the hard to reach and vulnerable people, so they have to resort to coming to places like these. If you look at the state of this place, highly unhygienic, it's cold, it's very poor lighting, obviously there's no washing facilities. If you look at the needles on the floor, most of them are left uncapped. There's human feces through that door in this back room. The conditions are completely appalling, and the aim of this video is to highlight the problem we have in this city, basically. Is it our duty of care? Can we let people inject in these situations? Can we let the harm carry on?
I asked passers-by what they thought about places like this.
As you can see, obviously evidence of drug taking. Yeah. Most of the needles are uncapped, you can see. Yeah? Yeah. If you want to pop your head through there and see the extent, there's not much lighting, unfortunately, but as you can see. Yeah?
You wouldn't want to see a dog in here, let alone a human being, to be taking drugs like this. You know, if you're going to do it, give it a place to, a nice clean environment, somewhere where they can get help.
It's a disgrace, isn't it?
It's a disgrace, isn't it?
Yeah, yeah.
Absolutely, absolutely. In this day and age.
It's only making people worse, isn't it? To come here in the first place.
These people got nowhere to go, so they figure the best option is to pull into the closest, most secure place in there. Yep. And it's just like, look, man, these guys, NHS, everybody spend billions and billions of different stuff, and where the money is actually needed. This is a problem also for the Environment Secretary.
Absolutely.
The Health Secretary.
Yes.
These are the guys that need to get together, sit down with local communities, in every major city in England, and figure out and work out a situation. Because, this is preposterous.
The good news is there is a way to address these problems within our communities. For example, there are over 75 drug consumption rooms where people can inject their drugs under medical supervision. Now, these services are proven to not only reduce the harm and the cost associated with injecting drug use, but they also increase entry into treatment, therefore enabling an individual to recover.
The idea is you've got a warm and safe, hygienic environment to inject, so you have a little table like this, hopefully there'd be a mirror there. I mean, this is just a quick idea what it could look like. On entry you'd be given obviously your sterile water, your chosen needle and barrels, although we would advise you on what would be the best one to use. Hand washing facilities, there'd be hot water basin for vein dilatation, obviously alcohol-free wipes, a disinfectant, of course cotton wool for after shots. Then you have your shot, get rid of the equipment in your sin bin, tidy up and go basically, and that's the idea.
Throughout this video, I will be asking key professionals, service users and ex-service users what they think about the idea of having a safe consumption room in Birmingham. I spoke to a pastoral worker who does street outreach for rough sleepers to share his experience of homelessness and injecting drug use.
So I go down into the car parks and into like some of the squats and the archways and stuff like that. Yeah. And we see people like, either shooting up or they're drunk out of their heads, if you know what I mean, drinking away. Yeah. But the filth and the needles that are lying around, you wouldn't get your breath, you just think, are we living in England? Yeah. Is this England? You know what I'm saying? It's frightening, really. And you see all the images of, like for instance, you go down the arches and they built all them really nice properties just above it, you just think, two different worlds. People are in complete denial, aren't they? They don't want to know it's there.
Yeah, that's right.
Do you know what I mean?
That's right. At the site, at the mind.
Yeah, exactly.
So,
and then when they do come across somebody that's dead, they're thinking, how did he get here in the first place?
There you go.
And then they're frightened and they think there's a human being there that's that's ended up dead. But how did he get there?
Well, yeah.
What are we doing, or what are the people that are supposed to be paid doing?
I interviewed 2 injecting drug using rough sleepers and asked them if they would use a safer consumption room and why.
It's safer, it's warmer, you don't have to rush, you can calm down, do it at your own time and know that there's someone there if things do go wrong, because things do go wrong.
Yeah.
I've also spoken to about 30, 40 other users and they said that it's the best idea that's come up.
Where about do you inject at the moment in Birmingham?
Car parks, anywhere out the way. You're not going to get disturbed because I have trouble getting myself and I've only got to hear footsteps and I'll just stick it in and get an abscess. And that happens a lot.
Do you know what to do about if one of your friends was to overdose? Would you know what to do?
Yeah, up to the first stage, yeah.
Fantastic, fantastic.
But the only trouble is, where people go and do the stuff, have a hit, there's not a phone box close by. So those 3 minutes, 4 minutes where I can run to a phone box, that could save someone's life. That's a matter of life or death.
Would you listen to the advice given on safer injecting there?
Most definitely, yeah.
Would be people there that you could ask questions about. You could just say if you had a dodgy batch of gear and something, God forbid, happened, you went over, there'd be a nurse on site to, you know, to attend your needs. You'd have someone there showing you how to safe inject. Any questions you could ask, they would probably be answered by someone who would be there.
I asked an ex-service user about his experiences of injecting in public and what he thought about a safer consumption room in Birmingham. Have you ever had to use in public in the past?
Yes, I have. I've used.
So whereabout did you use?
Subways, flat stairs, wherever I could get a place where I could use in it.
And how did it feel to use in those places?
It felt dirty, but had nowhere else to use in it. I know, like, my family didn't want to know me, so I couldn't go nowhere else in it.
Have you ever had any mishits?
Yeah, 3 or 4.
And then what happened then? What did you do?
Just had to go out and score again, because once you have a miss hit, you're not getting the effect off it, so it's just a waste of money, and then you have to go out and beg or rub for it to get it again, and so it's a bit like disturbing and that as well.
So would you have used a safe consumption room if there was one?
Yeah, I
would have gone. Yeah,
prefer that, because like at least there's no kids walking past when you're doing it, and I've had kids walk past me and I've had to hide or whatever I'm doing, and that. When we used to use it, we could have an old dose and who's there to. Because your mates wouldn't be there, they'd just run off, and at least if you've got nurses there, other people, and it feels more at ease if you're in them places and you're not like around kids and like around the public, and you're only in like a safe environment and that, so yeah.
I interviewed a long-term femoral injector and asked him to share his experiences of his injecting drug use in public places. So whereabout did you used to inject then in the past?
In toilets, mostly in toilets. Sometimes during the summer I used to go on the multi-storey car park.
Oh, okay.
The bloke on the like the shed outside the car park.
Yeah.
They know what you're going to do. You know what I mean? If you're just walking in, they've got a good idea.
So and, what kind of damage have you suffered? Oh my God.
That was the femoral artery burst. In my groin. That was through really misuse from my part.
So do you think if you was to come to a safe consumption room where there's drug workers, trained drug workers and nurses on site to advise you on safe injecting, do you think that would have happened to you?
No, I don't think it would have done, no.
I asked a hostel manager who deals with injecting drug users on a regular basis what she thought of having a safer consumption room in Birmingham.
There's too many places out there, disuse places, parks, that are at risk to children, members of the public, general society, and I think it needs to be brought to light more so that this isn't an issue that needs to be addressed. Many of those that are on the streets won't have access to benefits because they won't have either the know-how or just have not got the get up and go to do it. At least if somebody's there with any luck, it will reduce crime rates.
Absolutely.
Because they've got an income coming in. There's not the possibility of walking into, I don't know, a park, disused buildings, having a dead body, having needles, all the paraphernalia left all over the place. People just stigmatise drug addicts. They're bad people. They're not bad people. They've just got an addiction that needs to be helped.
I wanted to know what a nurse thought of a safe consumption room due to the fact that she deals daily with the consequences of poor and risky injecting behaviour.
I think anywhere that can save the lives of people, it's got to be a good thing. hasn't it? That's the moral issue really, and it's a moral issue. You need to save lives, and if that does, then I think yeah, it's very necessary. I think that's a good idea, and I also think that you would be coming, or you would be meeting people that you would not see otherwise, and we find that that we have certain people that come and see us, other people you have to go and find them. Yeah. But this would be somewhere in between, I think, so it would be like outreach extended, because it will be an outreach clinic, but they will be coming there. It's got to be trialled at least, I think, just to see whether it would work, And for us, yes, I think it would be, we see people in crisis, they come to us in crisis at times, where they've had DVTs, they've got abscesses weeping, and chronic infections of groin sinuses, and sometimes they are in that acute situation that we have to send them to hospital.
We're here at the QE hospital in Birmingham. We're currently waiting for an ex-service user who has been drug-free for many years now, but as a result of poor injecting techniques, especially femoral injecting, he's developed ulcers in the last year or so he has to come to hospital to have an operation, which I believe is quite costly. So, you've just come out of theatre, I believe. What did they do to you today?
I had some surgery on my right leg to have the vein closed up with a laser that was causing an ulcer.
Okay.
Yeah.
Okay. So, but you have been drug-free for 7 years now?
I have, yeah.
But you're still suffering complications?
Yes, I am, yeah.
And when did this start then, your ulcers?
The ulcers started about 3 years ago.
So at that stage you'd been clean 4 years,
yeah.
And then complications happened.
Yeah.
How many operations have you had since those ulcers started?
I have had, I think, 3 operations on the ulcers themselves, yes.
Wow. And the bandages?
I am in compression bandaging. I have been for the last year, constantly. Okay. And I have them done 3 times per week.
3 times a week?
So my dressings are changed 3 times per week.
3 times a week at £35 a go, that's roughly £100 a week.
Yeah.
So what complications did you suffer back then, in your using days?
Yeah, the worst complication I suppose was, I nearly lost my life in 1992,
Wow.
And I almost lost my leg. I had something called compartment syndrome. I was injected in my groin, got a lot of internal bleeding,
yep.
And I got something called compartment syndrome in my left leg, which caused my leg to compartmentise, and my skin, my tissue, my muscles started to die away. I got something called necrotising fasciitis.
Yep.
It's a flesh-eating bug. I got septicemia, and I was in hospital for 5.5 months. At the worst, I was 5 stone in weight.
Ooh.
I was in intensive care for over a month. And during that time I was in there, I had over 30 surgeries on my leg.
Whoa!
Yeah, to remove bits of necrotic tissue, bits of muscle. The whole back of my leg is missing.
Okay.
You can still see where the stitches were, all the way down my leg. This leg was open. They had to cut it open, and they left it open for a period of about 4 months. And then they would come in, and it was just packed with like wadding, and they would pull it out and and check to see if it was still kind of decaying away, if you like, and then they would cut more and more pieces off. The scar also goes down the outside of my leg, on the other side, here.
So you was lucky not to lose your leg
I
all your life.
I should have lost my leg, yeah. And they told my parents at the time I wouldn't live through the episode, Their actual words were, they wanted my parents to sign the paperwork to take my leg off because I was in such excruciating pain. They said they wanted to take my leg off and make me comfortable before I died because I wouldn't live out the week. My parents obviously refused to sign the paperwork, and I didn't die and I didn't lose my leg, I must have had maybe 50 surgeries in my time. I had 30 surgeries in the one sitting, in the one visit to hospital. In the 5 months I was there I had 30, 35 surgeries, but I've had dozens of surgeries since and previous. I've been in treatment for a long time, and post-treatment I'm still suffering major implications and complications as a result of my injecting. I'm going to be stuck in compression, bandaging and stockings for the rest of my life, and it's not a pleasant prospect. If I would have had the chance of accessing somewhere safe and clean to use, like a safer injecting room or a safer consumption room, I reckon the damage I caused myself in my early teens injecting on the streets of London and Birmingham injecting out of puddles and toilet bowls. You know, could have been averted. Some of this could have been, you know,
definitely.
The drain I have put on the NHS system maybe might not happen. You know.
Well, that was an eye-opening experience for me. I feel deeply saddened that this guy has been clean for 7 years and yet is still suffering complications due to his risky injecting behavior all these years ago. I just can't believe what he's gone through. I can't believe what he's going to have to go through. And if something could have been, some intervention could have been done 20 plus years ago, that would have happened to that stage, to that extent. You know, I'm just baffled by it and saddened. Well, I'm excited because we're on our way to Liverpool to a drug consumption room conference, and I'm hoping to interview two key speakers from Switzerland, Jacob Hubb and Robert Emig. They're the guys that opened the first one back in 1986. So hopefully we'll hear some good stories and good feedback about drug consumption rooms. And hoping to speak to Neil Hunt as well from the UK, that's done some extensive work on drug consumption rooms in the past. Hope it goes well.
My name's Neil Hunt. I'm a freelance researcher with honorary positions at the London School of Hygiene and Tropical Medicine and the University of Kent.
Thank you.
Robert Emig. I'm a psychiatrist and psychotherapist at the University Psychiatric Hospital in Bern, and I'm responsible for the addiction services at this hospital.
My name is Jacob Huber, and I'm director of a foundation in Bern that is working in the harm reduction field, and we are also safe injection rooms.
Okay, and I believe you were the one that opened the first one in Bern in 1986. Yes. And after 25 years, would you say they are successful in reducing drug-related deaths, transmission of HIV?
Yes, HIV infection in Switzerland in general is among drug users very low. It's not the main group. There are other groups that are more important nowadays. Just normal heterosexual transmission is on the lead. And
HIV dropped very much with harm reduction, and also especially with this needle exchange in the safe injection room, and deaths of the people dropped very much too. And even with this facilities, we integrated a lot of people into treatment, and we have less people using heroin in Switzerland.
Wow. There is no overdose deaths in any of the safe injecting facilities in all of the world.
That's great.
Not only in our place.
I can tell you in Birmingham, between 2009 and 2010, 33 people died of heroin overdose, so that's 3 people every month that died in Birmingham. What do you think of that?
3 people too much.
Thank you. Every month, 3 people died in Birmingham. This is just Birmingham, this is not UK, this is just Birmingham alone. What do you think my biggest problem is going to be in the UK to open up a safe consumption room in Birmingham?
There are several big challenges that you face. I think the risk of political opposition, because this is an area where it's a very vulnerable population, but there's not a lot of votes in it for politicians. So it needs a politician who is brave, compassionate, and is prepared to champion an unpopular cause. So I think that's one area. The other area that is very important at the moment, of course, is cost. Because in order to introduce a drug consumption room, clearly there are some costs in terms of staffing, equipment. Now, it's not, as I was explaining when I was talking earlier, it's not actually necessarily that expensive to do it. When people think about the big demonstration projects in Vancouver and Sydney,
that's right.
You don't need anything like that because of the UK situation is a much more distributed population of injecting drug users. So really drug consumption rooms, I think, in our big cities like Birmingham will map onto into needle exchanges fairly fairly naturally. And so you've got the planning issues already substantially addressed because you've got the service there. You've got the sort of the staff as a core resource that you can draw on. You've got a lot of the equipment that you need already coming in and out.
Finally, I wanted to hear from the person with the most experience in dealing with injecting drug users in Birmingham. Dr. Judith Yates has worked with injectors for over 30 years and is well aware of the dangers and consequences of risky injecting behaviour.
I am astonished that we don't have one. I think we should have one. We pretend that this doesn't happen. We pretend that young people aren't gathering in unsafe houses and squats around the city. We know that they are. I mean, for 20 or 30 years I've known that this is happening, and the fact we just look the other way, we pretend it doesn't happen. And if we could, clearly the thing that people need is first is needle exchange and is prescribed opiate substitutes, methadone, so we take. But to get to that stage of accepting that treatment, some people are not there, and the sooner we can get people into meeting with professionals and getting help and getting advice, the sooner we can help them to move along and stop damaging themselves, and also the shorter the length of time, hopefully, that they're damaging themselves, so that we don't see the longer term effects of poor technique and infections and everything that goes along with it. The research has been done, and we all know the costs of these things, and this simple intervention early can prevent all these damages later. Even if they're not ready yet to come into treatment, at least they can get some help and advice, and they can prevent they can prevent infections. They can learn not to damage themselves in the short term, and then in the medium term we can get them away from the damaging behaviour and into treatment. I've not visited, but I've read about other cities and other parts of the world, other countries where young people are being helped in this way, and I think it's time we had one in Birmingham. Really, I do.
Unfortunately, the police declined to be interviewed for this documentary, but some police officers I spoke to are actually for such a facility. They are fully aware that you will not stop people injecting drugs, and they agree that we're already giving them injecting equipment that we know they're going to use to inject illicit drugs. So why can't we give them somewhere safe to do so? It's beyond me. Any place in the world where these have been set up, public injecting is reduced. Many drug users have accessed treatment as a result of drug consumption rooms, and the health services obviously greatly benefited from it, as well as crime being cut down, So all in all, it's a winner, But again, we are faced with a moral dilemma. Which politician is going to endorse such a venture, It's about time we do something that is pragmatic about street injecting, and evidence clearly demonstrates their value for money, Drug consumption rooms not only save money, they save lives. Is it our duty of care to look after those hard to reach individuals in our communities? I think it is, don't you?